Hi and welcome. This is Dr. Barry. I want to talk to you today about bone pain. I see multiple patients every day who have bone pain, and the bone pain that's never been investigated or treated, they just have bone pain. And it's always been a mystery to me why doctors don't try to make this better or at least investigate and make sure it's nothing bad, because bone pain can range from easily fixable to very, very dangerous. And so we're going to talk about bone pain today. Please, though, take 1 second and share this on your social media. You probably have an older relative or a friend who has bone pain, whose leg bones just hurt and they don't really know why. We can help them with that and either help fix it or help them know what questions to ask their doctor so that if this is something dangerous, it is diagnosed and treated. So bone pain. When bone pain is usually called osteomalacia in adults, and it means softening of the bones, painful soft bones is what that means. It can be a very debilitating condition. Just imagine if every step you took, your shin bone or your tibia hurt. There are many, many older people who suffer from this and they don't really know why. A lot of doctors just chalk it up to being, over 30 or over 40 or over 50 or over 60. But that's very seldom the answer to any medical question. Just to thoughtlessly blame something on the patient's age, in my opinion, is not good medical care. There needs to be some things checked and some things treated, and usually we can make bone pain either go completely away or make it substantially better. So osteomalacia, let's talk about that. Osteomalacia is very, very common in older people. The symptoms are bone pain, just general body aches, muscle weakness, and it's usually the muscles that are closer to your body, like your hip muscles or your shoulder muscles. And so people with osteomalacia tend to have problems going upstairs or doing things like squatting, getting up or down from a chair. Sometimes they'll have a waddling gait or an unsteady gait because of the weakness of the hip muscles in osteomalacia. If you have osteomalacia as a child, it's called rickets. And everyone knows when I say that word that this is caused by low vitamin D almost always. Okay, not always, but almost always. It's caused by low vitamin D, and you can fix it by giving someone vitamin D. The most, by far, probably greater than 90% of the time a patient has painful bones, it's because their vitamin D is really low. Vitamin D optimally should be from between 50 and 90 on your American labs that we check in the U.S. There are different scales in different countries that I'm not familiar with, but in America it should be 50 to 90. A lot of docs get very nervous if your vitamin D gets up around 90. We've talked about in another video, it's a vitamin D video you can find on my page here, that there's been no evidence to ever show that someone had a bad outcome from taking too much vitamin D. Now, I obviously don't advocate taking too much vitamin D, but don't worry about it. If your doctor is checking your labs twice a year, you're never going to have an overdose of vitamin D. That's just not going to happen. But that's by far the most common cause of osteomalacia or bone pain is low vitamin D. Also, sometimes much, much less rarely, you can have low phosphorus levels in some people who have had one of the many different types of gastric bypass surgery. They can have bone pain because they're not able to absorb vitamin D or phosphorus or even calcium like they once did, and so that can lead to bone pain or osteomalacia. I mentioned calcium there. Very, very rarely you can have low calcium levels that can lead to bone pain, but that almost is never the case. I don't know if I've ever found a single patient whose blood levels of calcium were actually low. You can also, and so one of the very most rare causes of bone pain, but also the most dangerous, is bone cancer. You can have cancer in a bone or have metastasized cancer to your bones, which means it started somewhere else and spread to the bone, and that can cause bone pain and bone aches, and that's obviously very dangerous. And so if you have bone pain, don't just necessarily go get some vitamin D and start taking it. Go to the doctor and let him make sure that you don't have any kind of malignancy or cancer anywhere that's causing your bones to hurt. Let him check your calcium, let him check your phosphorus, and most importantly, let him check your vitamin D25 level, and then you'll have the full picture to know what should you do about your bone pain. So The worst thing that you want is you don't want to have bone cancer and that be causing your bone pain. So I know you guys have many older relatives who have just chronic bone pain every day. Please share this video with them so that they can get an answer to this, because it can't be fun to just be in constant pain. And definitely a pain that can be fixed if it's low vitamin D. So the way you would treat this if it is low vitamin D is to take anywhere from 2 to 10,000 international units of vitamin D3 every day. Now there is a vitamin D2 that some doctors like to prescribe because it's a prescription. And a lot of doctors think, well, if it's a prescription, it must be more legitimate and it must be better. But in all actuality, vitamin D3, which you can get over the counter, is more readily absorbed than vitamin D2. You always want to take your vitamin D with some kind of healthy oil, like avocado oil, olive oil, or bacon grease, and that helps with the absorption of the vitamin D as well. And then to help your body use that vitamin D, you want to go for a daily walk, and then even lift some weights to stimulate new bone growth, and that way your body can use that vitamin D to lay down good, healthy bone. If your doctor diagnoses you with low phosphorus, then you guys can talk about what you're going to do about that. If he diagnoses you with low calcium, then you guys can talk about what you're going to do with that, but that's probably not going to happen. If you're eating lots of greens and green vegetables, you're going to get plenty of calcium in your diet. Also calcium in meat as well. So vitamin D is by far and away the most common cause of bone pain, low vitamin D levels. And I've seen it, like I said earlier, it needs to be anywhere from 50 to 90. I've seen people come in with terrible bone pain that's debilitating. They really couldn't get out of a chair because their bones hurt so bad. Their vitamin D25 level would be 6. When it needs to be 50. And as soon as I usually start patients on 50 or 5,000 international units of vitamin D3 a day, 5,000, not 50,000. And immediately, it's like magic, their bone pain starts to go away. So again, if this information helped you, please subscribe to this channel. There's a little subscribe button right down in there somewhere. Just click that, and that's going to help you get notification the next time I have a bright idea about this. And please, if you have a family member who suffers from bone pain, please share this video with them or just share it on your social media so there can be less suffering in the world. This is Dr. Berry. I'll see you next time.